Today's topic, sensitive teeth. So roll that intro, let's get into it. What's up everyone, Dr. Eric Jackson here, hope you're doing well. So today's topic, sensitive teeth. Now this is a pretty broad topic. It's everything from intense short-term pain to long-term kind of occasional pain and everything in between. But obviously important to keep good dialogue with your dental provider about your specific symptoms. But let's talk turkey about several of the most common causalities for tooth sensitivity. Possible causes include cavities. They include fractured teeth, worn fillings or leaking fillings, gum disease, worn out tooth enamel, exposed tooth root, as well as classic grinding, clenching. All of these to some extent can cause tooth sensitivity, sometimes localized just one tooth, sometimes generalized across the entire mouth. That's why a list of symptoms is so important when trying to diagnose what the causality might be. You may have noticed that a lot of those causations I just listed deal with the outer layer being breached, right? The enamel layer, the outermost layer of the tooth is called the enamel. It is the armor of the tooth. So if a cavity has breached into the tooth, it will allow air and bacteria and cold liquids past the armor into what's the second layer called the dentin. The dentin is much more porous. It allows for temperature fluctuation through its tubules, much the same way if you have gum disease or if you have gum recession, the gum will recede away and expose the root surface, which is called the cementum. And much like the dentin, it is far more porous. It allows for more transfer of temperature and is very susceptible to tooth sensitivity. The good news is that sensitive teeth can be treated. It just takes a little bit of diagnostic, a little bit of Sherlock Holmes, right? Sometimes it's very straightforward. If there's a cavity and that single tooth is mildly sensitive, well then perhaps a filling, a crown, some sort of restoration can be placed to restore that tooth back to its full strength. Other options might be a little more applicable for generalized low-grade sensitivity. Fluoride toothpaste or fluoride application in a gel form or fluoride varnish helps to strengthen the enamel, helps to occlude and toughen up a lot of the exposed dentin or cementum, much the same way that a sensitive toothpaste would with its active ingredients. Those two options are great. They're non-invasive, they're low cost, they do work. They're not miracle cures necessarily, and I wouldn't necessarily put all my faith in the fact that you have sensitive teeth and all of a sudden a tube of Sensodyne is going to solve that problem. Like I mentioned earlier, there are multiple causes. So sensitive teeth can be caused by other things that must be addressed by the dentist. There's also gum issues, like we said, the gum disease and gum recession. You know, good maintenance, keeping your gums clean with regular dental hygiene, visits to the office. If recession is severe enough and if things are indicated, you may be recommended to get a gum graft, where a piece of gum of your gums is used and harvested to cover over the missing structure, and it blends in real nice. And there's multiple different sources and potential sources of that gum, which is a separate video here. But ultimately, the key is being able to cover over that exposed cementum and then keep things clean. So you've got yourself your non-invasive potential solutions in the toothpaste and fluoride. You've got yourself your invasive restorative procedures, such as your fillings and your crowns and whatnot. Then you've got your invasive gum surgeries and preventative types dental hygiene visits. All of these options should be investigated. In addition to the final one, which I mentioned, it often goes overlooked. Grinding and clenching can absolutely cause very low-grade, sporadic, kind of generalized tooth sensitivity. Especially since the pandemic, we've seen such an uptick in kind of vague symptoms, and it's never a bad idea to swing over to your local pharmacy, grab a over-the-counter night guard, and see if you can tolerate it, see if it helps out. It's going to cost you about $25, give or take a little bit. And it's a very good diagnostic tool, which then you can present to the dentist or your dental professional when you go on in there to get looked at in case it doesn't work. Or if it does work, you know that you absolutely should consider something a little bit more robust, maybe a custom-made night guard or whatnot. So you'll be able to have a lot more leg up in the conversation for just a simple little visit to the pharmacy. I'll finish by saying that ultimately tooth sensitivity is something that can come and go, but prevention is key. If you're keeping up with your checkups, if you're keeping up with your dental hygiene both at home and in the dental office, things should be well controlled. We don't want to have large oscillations of issues. We don't want to have consistent problems. We're all human though. We're not getting healthier as we get older, so some wear and tear, symptoms, problems, maladies are acceptable. But as long as you're doing your job at home and you're taking care of your teeth in the office, I hope that everything is very minor for you. Appreciate your viewership. As always, go ahead and leave comments and questions below. If you like the video, go ahead and give a thumbs up, like, and subscribe to the channel. Try to put out regular content. Really like this kind of a little bit longer format. It gives us a chance to sit both for my current patients and potential patients. You don't want to often have 6, 8, 10 minutes just to sit and talk about a specific topic in the office. Nor do patients necessarily want to. That's the beautiful part of YouTube. You can sit there on your own time, search for the parameters that you like, and learn a lot. So thanks for your viewership. I'll see you in the next video. Take care now. Bye-bye.